Welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and today I'm very, very excited to be introducing you, Dr. Ameet Aggarwal. And Dr. Ameet is an old friend. We went to naturopathic medical school together, but he lives in and resides and practices in Kenya. And on top of that, he's an international speaker. He's a best-selling author, a psychotherapist, and family constellations therapist. And he goes beyond healing the body, not only with supplements and nutrition, but bringing the whole mind-body connection together. And Dr. Ameet also focuses on healing emotional causes of illness, which includes healing childhood trauma and ancestral trauma with homeopathy, psychotherapy, and family constellations therapy. And Dr. Ameet's books and online courses are renowned for helping people around the world with anxiety, depression, weight loss, hormone balance, trauma, and liver detox. And this is exactly what we're going to be focusing on today. So welcome, Dr. Ameet.
Thanks, John, and welcome everyone. Super excited to go into the real deep liver cleansing remedies and why the liver is so important for your health.
Absolutely. Well, listen, first of all, this is a gut summit, and a lot of us know what that means. But why are we talking about the liver? What does the liver have to do with digestion and everything that's going on within our gut?
Okay, John. So, the liver is the master organ, right? In Chinese medicine, in many cultures, the liver is actually considered the master organ or even the seat of the soul. Now, what does that mean? So the liver performs like thousands of functions, from bile production, liver detox for detoxing your whole body, immune cell activation, cholesterol metabolism, hormone metabolism, yeah, you name it. And so what's that got to do with the gut? Well, you have these good bacteria in your gut, right? Everyone's focusing on taking probiotics, glutamine, vitamin D, all that stuff. But what makes those bacteria thrive? It's a good gut environment and healthy bile flow, right? Where does bile come from? From your liver, right? So most people make a mistake of only taking probiotics and changing their foods and avoiding gluten and dairy, and they forget about healing their liver. And so when you do a good liver detox, and I'll share some remedies with you today, bile flows in better amounts and in better quality. I think bile quality is also important. And when that happens, first of all, it lubricates your intestines, right? And so if you have constipation, gas, bloating, etc., when you have proper bile flow, then you have less constipation because there's more lubrication. And then you also have less cramping, bloating, etc., because bile is very important for digestion. So instead of popping digestive enzymes all the time, think about moving your bile through a good liver detox to improve digestion from the root cause. So this is all about healing the root cause, right? Now, also, the bile salts actually can kill off some negative or bad bacteria as well, right? So having healthy bile with the right bile salts in there will also correct any dysbiosis, amongst other supplements, of course, right? But people who are only taking parasite killers and, anti-candida pills and whatnot, without maintaining good bile flow, are really fighting an uphill battle. And we don't want that, right? Because your body becomes more and more toxic with all the die-off. So if you go to that liver and flush it out, have the bile flowing, everything else in your body self-corrects.
Fantastic. Well, how do we know? Does everyone with gut issues have a liver and a bile flow issue? Are there certain signs? Are there symptoms that we can look for that could be really significant that is telling us what's going on with our liver? Anything we should be looking for?
Yeah, absolutely. So honestly, without exaggerating, I think 90 to 99% of people have liver stagnation issues, according to TCM, Chinese medicine. Okay. Why? Because most people are having some sort of pesticides or preservatives. Stress impacts the liver, so it compacts the bile flow or the lymphatic flow in there as well. When you're shallow breathing, your diaphragm is not massaging your liver, so it's going to become more stagnant, right? Mm-hmm. And also when you're stressed or traumatized, what happens is your nervous system gets dysregulated. And when when your nervous system gets dysregulated, this big nerve called the vagus nerve, that also gets dysregulated. And the vagus nerve controls the function of your gut, of your liver, of your heart, of your breathing, and many other functions, right? So when the vagus nerve and your other parts of your nervous system get dysregulated, then the cytokines, the chemical messengers sent to your liver are altered. And so you're having some sort of negative effect on your liver as well. So most people have some sort of liver stagnation or toxicity, whether
Oh,
it's from what I described, stress, toxins, medication, additives in the food, the wrong diet, and
mhm.
inflammation. Inflammation is a big cause of liver toxicity and stagnation, because when you eat unhealthy and you have inflammatory foods or you have leaky gut syndrome, toxins leak into your bloodstream. And that causes inflammation everywhere in your body, including your liver. And
Mhm.
guess what? When your body's inflamed or overinflamed, you start creating toxins in your body from inflammation. I call that autotoxicity. Those toxins also have to be processed by your liver. So your liver is just jam-packed with, the impacts of pesticides, autotoxicity, stress, you name it. So good liver detox, almost on a monthly basis, is highly recommended.
Oh, interesting. Yeah, I was going to ask you, in terms of what you recommend, and we'll get into some of the very specific treatments in a moment. But so monthly is a good idea. Now, I'm sure, like yourself, many of our patients, they come in, they're already eating organic. They're already really making good food choices. They're not eating the standard American diet as it's known, and a lot of fast foods and so forth, et cetera. But they're still going to be exposed to toxins. Like these are things that are ubiquitous in our environment, aren't they?
Absolutely. Absolutely. From the fumes we breathe to the chemicals we touch, our skin absorbs a lot of stuff as well.
Hmm.
Um, there's always toxins around. And remember, our liver is working hard also to metabolize products in our body, right? So if we don't have the right nutrients all the time, right? Lack of B vitamins, lack of magnesium, then those nutrients, lack of glutathione, all those nutrients are important for a good liver function, liver detox. Okay. So not only from toxins, but a lack of nutrients can also lead to liver stagnation.
Right. Yeah, it's amazing. We actually measure a lot of these nutrients with our patients, and the amount of these that are constantly deficient is staggering. So it is a great first step is just to start to replete some of these core nutrients, because you're only going to benefit from these. These nutrients are fundamental. Each nutrient has over 200, sometimes more jobs per second in your body. And if we're constantly depleted in B vitamins, as you say, or glutathione or methionine, whatever it might be, this really impacts not only our liver, which has that huge downstream impact that you've alluded to, but many, many other systems in the body.
Absolutely. Absolutely. From hormones. So a lot of people with PMS symptoms and fibroids and cysts, they're taking hormonal remedies, they're changing their diet, they're avoiding this and that. Often I find hormonal imbalances and PMS related issues often come from liver stagnation as well.
Mm-hmm.
It's often a progesterone deficiency, right? So when progesterone is low, then what happens is you'll get those typical symptoms of breast tenderness, cramping, clotting, and also anxiety and depression, because progesterone helps GABA work better in the brain. GABA is our anti-anxiety neurotransmitter. Um, so if you're low in progesterone, you might have more anxiety, more insomnia, and hormonal issues, right? That's just one example. But because the liver controls cholesterol metabolism, you're looking at heart disease as well, being controlled through detoxifying the liver. We have glucose metabolism and glucose storage happening in the liver. So everyone's focusing on the pancreas and insulin and diabetes. But once you start moving the liver, your insulin levels will, in my experience, regulate much faster compared to just taking chromium and pancreatic enzymes and things like that.
Right. Well, and you bring, these are so crucial, but the part that stuck with me at the beginning is you touched on, the vagus nerve, which has a massive connection to our CNS or our main brain, but it goes into our heart, it goes into our gut, and it's often impacted tremendously by emotion, isn't it? And stress. And so talk to
Yes.
me, and I know this is a big part of your practice, connecting the liver and the body with what's going on with toxic emotions and stress emotions that are not regulated well. Can you expand on that, Amit? And just, I know we could talk all day on this, but let's dive into this. Bring us up to
Okay,
speed what we need to know.
perfect. All right. So when you experience emotional trauma as a child or as an adult, you go into a fight or flight state, right? That means you make more adrenaline and cortisol produced by your adrenal glands and other cells in your body. And what happens is being in constant stress creates an overproduction of all these chemicals, and you burn out your adrenal glands. And also, your nervous system is dysregulated, trying to compensate for that unhealed trauma and or constant stress. Yeah. So in that compensation, your vagus nerve and other parts of your nervous system start releasing different chemicals into your body. So your liver starts acting differently, your gut starts acting differently. Yeah. For example, a lot of people will have heartburn when they're stressed. You can see the direct emotional connection, yeah,
Absolutely.
connection of emotions to physical body. So I'm not making this stuff up, yeah. I get a lot of people who have been abused during childhood, and they'll often have migraines, for example, yeah, or people with repressed anger will have this tension in their jaw and other parts of their body, right? And so you can see how unhealed emotions, what happens is unhealed emotions from childhood, they get exaggerated, or the stress response gets exaggerated when new stresses come into your life as an adult, because the new stresses trigger the emotional response you had as a child. So not only is it important to meditate and de-stress, but it's also important to heal childhood trauma, yeah, which I talk about in my course, and also heal ancestral trauma, yeah, through family constellations therapy, using homeopathy as well and other therapies, so that your nervous system comes out of that state of compensation. And when it comes out of that state of compensation, your vagus nerve gets more regulated. Your entire nervous system gets regulated. Your adrenal glands don't burn out so much, right? And when they don't burn out so much, your cortisol levels come more into balance. And why is that important for gut health? Well, when your cortisol levels are imbalanced, what happens is your thyroid hormones don't work as well. Your conversion to T4 to T3 is compromised. And now in your gut, you have all these cells sticking together, right? Making this little nice barrier, this nice lining.
Mm-hmm.
But if you don't have enough T3 being produced in your body, the active thyroid hormone, these junctions, these cell junctions, these joints are going to be weak. So you're going to have more of a leaky gut going on as well, just because of stress creating a cortisol imbalance affecting your thyroid hormones. And also from the liver side of things, the liver improves the health of your bacteria, the good bacteria in your gut. And the good bacteria in your gut are also responsible for converting T4 to T3. Most of it actually happens in the liver. Yeah, about 70% of T4 is converted to T3 in the liver.
T3 being the active thyroid hormone.
The active thyroid hormone, yes. So now imagine you have stress affecting cortisol, affecting thyroid conversion. You have lack of bile flow as well, affecting the bacteria convert T4 to T3. And also the good bacteria also create a lot of neurotransmitters, feel good neurotransmitters like serotonin and GABA. And also if 70% of T4 is being converted to T3 in your liver, and you have a toxic liver, that conversion doesn't happen so well. So again, you're going to get low thyroid symptoms. Your TSH might be fine because your T4 is high enough, but the conversion's not happening. So you're going to what we call subclinical hypothyroidism.
Mm-hmm.
So rather than only taking thyroid medicines, we got to support the adrenal system, release trauma and stress, and detoxify the liver.
Do you find that most people are aware of their past traumas, or do you have to pull it out of them in a way or prompt them in a way? Because we've seen all sorts of different cases, and some people, it doesn't come out right away. And it's not that they're purposefully hiding it, but sometimes our body has had compensatory mechanisms to push this under the rug, so to speak, so to protect ourselves almost in that vulnerable young age. So what do you see, Amit, in terms of this trauma that can be happening, whether it's childhood or even adult trauma?
Okay. So in my course, I have an exercise to help you discover the emotions around certain events in your life, because we often normalize a lot of events, right? For example, I grew up in boarding school and local schools in Kenya, and caning was normal. We were beaten every day with sticks,
Wow.
right? And teachers would shout. And so those create compensations in our nervous system, right? We go into fear. We have a projection of like the danger of large people or certain people who look certain ways, but we don't label it as trauma. We just think, oh, that was normal. I got over it. I'm living my life. Life is fine. Yeah. But when you're maybe when you're doing some work, you're overperforming because you're afraid of being punished. Yeah. Or you're afraid of dad going missing because he abandoned you a lot. So you're working extra hard to get his attention back. not consciously. You just find yourself looking for approval, maybe, right? Because of an old abandonment that you're not aware of. So when somebody comes into, so we work online as well, I sense their behavior and I can see how incongruent it is to their nervous system and to their authenticity. Yeah, and certain behaviors are creating sabotaging behaviors, really, or they're getting more anxious or depressed, right? So most people have some form of trauma, whether it's abandonment, abuse, seeing conflict at home, parents fighting, right? Wanting mom's love. Maybe there was a sick child, a sick sibling who got all the attention, so suddenly you felt second place. Those are normal adverse childhood experiences. We call them ACEs. Then there's also ancestral trauma or family trauma, which I heal using family constellations therapy. Now that's looking at, things that happened to our grandparents and our parents, or miscarriages and abortions in the family. That's very, very important to look at, because those kind of events, even old love affairs and secrets in the family, are kind of entangled in our nervous system, right, energetically, and in our DNA, right? And they've done studies, right? Children of the victims of the Holocaust or other stressful events like 9/11 as well are more prone to anxiety, depression, altered cortisol levels, right? Because it gets wired in our DNA and it's passed on from generation to generation, right? So it's important to also look at your family history and really be open and honest about what's happened in your life, because there are ways to heal these events using what we call healing sentences in family constellations therapy. There are ways, okay? And I talk about it in other videos. And once you understand how to really release yourself from these entanglements, you begin to heal the root cause of nervous system dysregulation and possibly also physical ailments.
There's a little saying that I'm sure you're familiar with. If you step on a thumbtack, it doesn't matter how many Band-Aids you put on that thumbtack, you still have to take the thumbtack out to heal. And, we see that so much with trauma, whether that's, past physical or emotional trauma. If we haven't dealt with that properly, it's going to fester. And much like a thumbtack in your heel for years and years, that's going to create a mess. So we do want to make sure that anything that's possible to help clear these out is being done. And, your work. And I kind of want you to touch on a little bit more of constellations therapy. This might be a newer term to some of our listeners. And because it's not something I'm super familiar with, but I understand what it's about. Can you just expand a little bit how past generation trauma impacts us today? Like, how does that work with our DNA?
Good question. I don't know if I can scientifically explain it, but there's evidence of it.
Yeah, sure. And, we don't need the textbook explanation. Just give us the overview, the Dr. Ameet overview.
Right. So basically, we are loyal to our family members. We have this blind love. Okay. So let's say mom is abused by dad. Okay. Most children will side with mom, takes mom's side and reject their father. Yeah. And maybe mom will confide in them. Then they'll feel responsible for mom's feelings. So in a way, they're always rescuing mom. Automatically there, the child is becoming the parent to the mother, which is out of balance. Okay. The other thing that's happening is we're excluding the father and only focusing on mom. Again, an act of imbalance. Yeah. We don't realize it's happening. It's subtle, but it's happening. All these little nuances that we do, right? Micro adjustments, create a dysregulation. And suddenly you're growing up as an adult, you end up in a codependent relationship. For example, you associate love with taking care of someone or somebody having problems. Mm-hmm. Yeah. And I often see people who reject their fathers or one parent have low immunity or liver stagnation issues as well. It becomes physiological. Absolutely. All right. So in family constellations, and I teach this at the retreats that we're holding, we look at these orders of love, whether it's excluding someone, or overtaking care of someone, taking the responsibility of somebody else's feelings. Okay. And a common example is having a miscarriage or an abortion. right? If I am, let's say, the second child in my family, which I am, but let's say there was a child that was aborted or miscarried, I am actually energetically the third child. But if I don't acknowledge that child, I assume I'm in the second position. I might try and do things for the second position, and I'll feel anxious because I'll feel a bit overwhelmed because it's not really my right position. And when I acknowledge this child before me, and I say, dear mom and dad, let's acknowledge this child. Dear sibling, you know, I'm sorry you had to leave, or I've missed you. And I see your place before me. I'm in the third position. Right away, my nervous system relaxes. Right away. And I've seen this time and time again. Like, people have come to me for different therapies. We've done homeopathy, we've done gestalt therapy, etc. And finally, when we acknowledge the right position, or we correct the imbalance with the constellations therapy, they don't need any more therapy. They don't need any more homeopathy because we've treated the root cause.
Fascinating.
Right?
Fascinating.
And genetically, we can explain this. For example, let's say your grandmother experienced the war, right? And so her physiology changes, her cortisol levels shift, right? She's preparing for danger. So when her physiology changes, the eggs in her ovaries will change a bit as well, right? So your mom, who's born off your grandmother, will have an altered physiological response to danger, stress, to life, right? And your mom gave birth to you, so your nervous system and your physiology is already pre-programmed based on the experiences of your ancestors.
And this has such a downstream impact on our DNA, of course, but that's going to impact our organ systems. It's going to impact how we digest and ultimately our liver and everything. And so, again, we're oversimplifying, I'm sure, what you teach, but this is extremely fundamental to know and to start to look for when we're trying to heal. And if we're not healing, I always say, if you find that the usual treatments that we hear and learn about in these summits and online and so forth, if they're not working for you, there's often hidden trauma. There's often hidden emotional blocks that need to be resolved. And that's just a clinical pro we've seen as well.
Yeah. No, I see that time and time again. People have been for years of therapy, years of supplements. And suddenly when we release the right emotion or acknowledge the love, it's just an acknowledgement of the love that was there, that was not acknowledged. There's a huge release in somebody's heart and nervous system, and everything changes. Their body relaxes, their saliva starts flowing, their digestion improves, the tension in their back just diminishes, and they start living life from clarity and truth again.
I love that. Wow. Let's bring it back to some takeaways that we can leave people with today to help their liver from, what that be with food, supplement, and even homeopathy on it. So, maybe let's start with homeopathy. I want to hear a little bit more about what you recommend. I know you are an absolute expert in this space as well. So how can you help somebody who's got this liver congestion or stagnation or even gallbladder dysfunction? They're connected. To improve that bile flow, to improve that functionality of the liver. What do you prescribe from homeopathic standpoint?
Okay. So when somebody comes in with issues, I look at their whole picture, their emotions, because in homeopathy, we look at the emotional character as well as the particular symptom somebody has. Okay. And I cover this in the online course, but I'm going to give you a few remedies, important remedies that are good for the liver. But why homeopathy for the liver? Well, herbs and everything work wonderfully, but homeopathy, because it's energetic in nature, it actually stimulates the liver cells to detox more deeply or to heal at a deeper level. So adding homeopathy to a herbal protocol takes your healing to another level, a more permanent healing, in my experience. So when somebody comes in, let's say they have a lot of gas and bloating, right? And maybe they have low confidence and trouble digesting, and maybe their symptoms are worse with hunger. That's a complete picture in a way. That typically is a remedy I use, typically is a remedy called lycopodium, all right? Versus somebody else who has more constipation. Remember I told you bile flow is super important for constipation. So instead of relying on laxatives and magnesium and all that, right, it's important to heal bile flow. So if somebody has a lot of constipation and their poop is like little sheep pellets, or they have hemorrhoids, because hemorrhoids is all connected to liver function, because the veins are not draining backwards into the hepatic portal vein well enough. So there's a stagnation, right? So you can see why liver, constipation, hemorrhoids, and liver go together. So anyways, if somebody has those symptoms, stubborn constipation, maybe some irritability, workaholic, using too much alcohol, etc., a remedy I often use is Nux vomica, right? And I cover these other remedies in the course. I don't want to give it all away, but it's important to look at the unique picture of a person and then pick the remedy. And then I also use remedies for trauma, right? Homeopathic remedies. So we look at the kind of trauma a person has. Was it abuse? Was it abandonment? Was it physical? Was it sexual? Was it emotional? Was it financial? So there's remedies for that. Then we look at the response. Did the person respond with fear, cowardice, right? Or did the person respond with anger, aggression, or withdrawal, guilt, suicidal thoughts? Each person's response is different. So based on the response and based on the type of trauma, we select the remedy. And because of its uniqueness of looking at the symptoms, the unique symptoms, homeopathy heals much deeper than just using supplements alone.
You find it as a good, powerful adjunct to do both together, do you?
All the time. Yeah. So including herbs for the liver, which are often like milk thistle, dandelion, the bitter foods as well. You want to have bitter greens like rocket. I think you call it rocket or rucola in Canada. I'm not sure.
Yeah.
Rugula. Then in Indian cooking, we have something called bitter gourd, or in Hindi, it's called Karela. I drink the Karela juice once in a while. That really stimulates bile flow also. Turmeric is an excellent spice to add for the cooking. It's an antioxidant. Remember, your liver is going through oxidative damage, right? Because it's clearing a lot of toxins. So you got to give your liver a lot of antioxidants. That's your glutathione, your selenium, your vitamin A, C, E, right? Turmeric is excellent. The berries are excellent sources of antioxidants as well. So in addition to protecting your liver cells and healing them with antioxidants, you got to improve bile flow. And that's where the bitter foods come in. And the milk thistle and dandelion also stimulate bile flow. And there's other herbs as well, of course.
You can use these in a tea form as well, largely, right?
Yep. So dandelion tea, I love making a cardamom, fennel, mint tea as well. All those are bile stimulating also and improve digestion. So there's definitely different herbs out there. Sometimes I'll use neem, but that's too strong. We get a lot of neem tea here in Kenya, and that kills a lot of bugs as well. So I'll put a tiny bit of that in there. Caution though, it can also stagnate your liver because it's quite strong, and it can reduce sperm count. So you don't want to take too much of it. What else? Yeah, there's tons of different forms out there.
I believe peppermint and chamomile, these are other good tea options that are great for bile flow and gallbladder and liver.
Yep, absolutely. Chamomile is wonderful because it's also digestive and a carminative. So it soothes the intestinal lining, and relaxes the nervous system. And when you relax the nervous system, you go more into better peristalsis, and you go into your parasympathetic state. And in parasympathetic state, of course, bile flow is much better, digestion improves, relaxation happens. And when you're more relaxed and you sleep better, then you produce more melatonin. And when you produce more melatonin, melatonin is very important for stimulating glutathione production in the liver as well. So it's all interconnected. Our sleep, our emotions, our liver, our gut. You got to take care of the whole being, mind and body.
Wonderful. Well, it is so true. We are very intricate beings. We're not like an auto repair shop where if you have a flat tire, you swap out the tire. We have to make sure we are looking at all the connections, which I know you do very, very well. Now, anything else we need to know about the liver and how it impacts the gut? Any other takeaways you can offer today?
I just took a deep breath. So deep breathing is very important. Why? A couple of things. When you take 3, 4, 5 deep breaths, 5 times a day or whatever, one is you regulate your vagus nerve. You help your nervous system calm down. And as I've shown, that helps your liver and your gut. Also, deep breathing, what happens is with deep breathing, your diaphragm goes lower. So you actually end up massaging your liver. And massaging the lymphatics. So that improves bile flow and lymphatic flow through your liver, which aids in detoxification. People who are stressed, or often have tight shoulders. Why is that? Because they're shallow breathing, right? And when they're shallow breathing, they're just using the upper muscles, right? Of their shoulders or lungs or whatever. And that's why they're getting tight shoulders and they're not diaphragmatically breathing. And when they're not doing that, they're going to get heartburn, ulcers, etc., because of liver stagnation connected to stress and lack of diaphragmatic breathing. So deep breathing, super important for gut health and liver health and vagus nerve health, of course.
To put this back into a scientific conversation, there are studies that show if you do 10 consecutive deep breaths, and you do that virtually every hour throughout the day, you don't have to set an alarm to stress you out to do that, but if you do that on the regular throughout the day, you are going to improve your stress response. You're going to reduce stress by up to 40%. And this is research coming from Harvard University. So, Amit, this is very powerful, very applicable. And very timely, I would think, now more than ever. So, these are wonderful suggestions. But listen, thank you so much for all of the sage advice today and knowledge and wisdom. And how do we find out more about you? How do we find you online?
So there's a free course with gut health, liver detox, adrenal support, and emotional healing exercises on drameet.com. That's drameet.com. Then I have a full course that has all my liver detox protocols, the homeopathics, the homeopathy for stress, trauma, emotions, anxiety, and depression. A lot of the protocols we've talked about, including emotional healing exercises. And on my website, you'll also find out that I'm doing retreats in different parts of the world. So if you're up for a safari in Kenya, combining with a beach holiday, yoga, trauma release, yes, you're coming. Awesome. I've been waiting for you. And of course, holistic medicine education. I'll probably be doing some in Sardinia or somewhere in Europe as well, in Italy. So whatever is easier for you, would love to have you over. But start with the online course. It's really powerful, it's transformative, and it really helps you heal the root cause. Yeah, when you peel away those emotions, you get more of a handle on your life. So I'd encourage you to see drameet.com, drameet.com.
Well, thank you, Dr. Ameet. You are a awesome person. I love to know you, and thank you for sharing all of your wisdom today. Really appreciate it.
Thanks, Johnny. And good luck, everyone, with your liver and your gut. Lots of love.